Sepsis can begin with something ordinary: pneumonia, a urinary tract infection, an infected wound, or an abdominal infection. At first, the problem may seem local, limited to one part of the body. But in sepsis, the danger is not only the germ itself. The real crisis happens when the body's response to infection becomes dysregulated, meaning the immune system's attempt to fight the invader starts injuring the body's own tissues and organs. This is why sepsis is sometimes called blood poisoning, although that term can be misleading. The bloodstream does not always have to contain bacteria for sepsis to occur. What matters is the body-wide reaction to infection and the damage that follows. Sepsis is a medical emergency because it can progress quickly from infection to organ dysfunction, shock, and death if treatment is delayed. The immune system is designed to detect threats and respond with inflammation, fever, and chemical signals that recruit white blood cells. In a controlled infection, this response is targeted and useful. In sepsis, that response becomes chaotic. Blood vessels may widen and leak fluid into tissues. Clotting may be activated in tiny blood vessels. Oxygen and nutrients may not reach organs efficiently. Instead of helping the body recover, the immune reaction can reduce blood flow, damage cells, and disrupt normal organ function. This is why sepsis is not simply a bad infection. It is a complex syndrome where infection triggers a harmful chain reaction throughout the body. The lungs, kidneys, brain, heart, and liver can all be affected, sometimes within hours. Common warning signs include fever, a fast heart rate, faster breathing, and confusion or unusual sleepiness. Someone may feel extremely weak, look very ill, or seem different from their normal mental state. The infection source can create its own clues. Coughing and shortness of breath may point toward pneumonia, painful urination or back pain may suggest a urinary infection, and redness, swelling, or drainage may suggest a skin infection. But sepsis can be hard to recognize because symptoms are not always dramatic at first. Some people do not develop a high fever. Older adults, infants, and people with weakened immune systems may have a normal or even low body temperature. In these groups, confusion, poor feeding, reduced activity, or sudden decline may be the most important warning signs. Sepsis becomes especially dangerous when it interferes with blood flow and organ function. Doctors watch for signs such as low blood pressure, low urine output, abnormal breathing, changes in consciousness, and elevated blood lactate. Lactate can rise when tissues are not getting enough oxygen or are under severe metabolic stress. Reduced urine output can signal that the kidneys are not receiving enough blood or are starting to fail. When organs begin to malfunction because of sepsis, the condition is more severe and requires urgent hospital care. Septic shock is a critical stage where blood pressure remains dangerously low despite fluid replacement, or medications are needed to keep blood pressure high enough. At that point, the body's circulation is failing, and the risk of death rises sharply. Many different organisms can trigger sepsis. Bacteria are the most common causes, including both gram-positive and gram-negative bacteria. When bacteria are involved, the condition may be called septicemia, although sepsis itself is broader than bacteria in the blood. Viruses and fungi can also cause sepsis, and in children, viral infections and diarrheal illnesses are important causes in many settings. The primary infection often begins in the lungs, urinary tract, skin, abdominal organs, or sometimes the brain and nervous system. In real clinical practice, doctors do not always immediately know which germ is responsible. In many cases, an infectious pathogen is found, but treatment cannot wait for every laboratory result. Sepsis care often begins while tests are still being processed, because time is one of the most important factors. Some people are much more vulnerable to sepsis than others. Babies and very young children are at higher risk because their immune systems are still developing. Older adults are at higher risk because immune defenses, organ reserves, and the ability to compensate for illness often decline with age. People with weakened immune systems, such as those with cancer, diabetes, advanced chronic disease, or those receiving immune-suppressing treatments, also face greater danger. Major trauma and burns increase risk because damaged barriers like skin make infection more likely, and severe injury can strain the whole body. The severity of sepsis also depends on the virulence of the pathogen and the amount of microorganisms present, sometimes called pathogen burden. In simple terms, both the person's condition and the aggressiveness of the infection shape the outcome. Recognizing sepsis is challenging because there is no single symptom that proves it. Doctors combine the patient's story, physical examination, vital signs, lab results, and imaging. One bedside screening tool is called QSOFA, short for Quick Sequential Organ Failure Assessment. It highlights 3 concerning signs: a fast breathing rate, altered consciousness, and low blood pressure. Having at least 2 of these raises concern for a higher risk of poor outcome in someone with suspected infection. However, QSOFA is not the whole diagnosis. It is a warning tool, not a replacement for clinical judgment. Doctors also consider other conditions that can look similar, such as anaphylaxis, heart failure, pulmonary embolism, low blood volume, or adrenal insufficiency. The goal is to identify sepsis quickly while not missing other emergencies. Testing helps confirm the infection source, estimate severity, and guide treatment. Blood cultures are often obtained before antibiotics when this can be done without delaying care. Cultures may show which organism is causing the infection and which medications are most likely to work. But sepsis does not require a positive blood culture. The bloodstream may not show the organism, or antibiotics may have already affected the result. Other tests may include blood counts, kidney and liver markers, lactate levels, oxygen measurements, urine tests, and cultures from suspected sites. Medical imaging, such as chest X-rays, ultrasound, or CT scans, can help locate pneumonia, abscesses, blocked urinary infections, or abdominal problems. Finding the source matters because some infections require drainage, surgery, or removal of an infected device in addition to medication. Treatment for sepsis is immediate and aggressive. The first priorities are restoring circulation, fighting the infection, and supporting organs that are under stress. Intravenous fluids are commonly given to improve blood volume and help blood pressure. Antimicrobial medications, such as antibiotics, are started quickly when bacterial infection is suspected, and may be adjusted later based on culture results and the suspected source. If blood pressure remains too low after fluids, doctors use vasopressor medications to tighten blood vessels and maintain blood flow to vital organs. This is often done in an intensive care unit where the patient can be monitored continuously. The principle is simple but urgent: stabilize the body while controlling the infection before the cycle of inflammation, poor circulation, and organ injury worsens. Severe sepsis may require advanced life support. If the lungs cannot provide enough oxygen or the person is too exhausted to breathe effectively, mechanical ventilation may be needed. If the kidneys fail or dangerous fluid and chemical imbalances build up, dialysis may be used. Doctors may place a central venous catheter to deliver medications safely and monitor treatment, and an arterial line to measure blood pressure continuously and draw blood samples. Care teams also track urine output, oxygen levels, blood pressure, heart function, and laboratory trends. Sepsis care is not just one medication. It is a coordinated effort involving emergency. Physicians, intensivists, nurses, pharmacists, respiratory therapists, laboratory staff, and sometimes surgeons or interventional radiologists when source control is needed. People with sepsis are also at risk for complications caused by critical illness itself. Reduced movement can increase the risk of deep vein thrombosis, meaning blood clots in the legs that can travel to the lungs. Stress ulcers can develop in the stomach or intestines during severe illness. Pressure ulcers can occur when a patient is unable to move normally for long periods. Preventive measures may include blood clot prevention, stomach protection in selected patients, careful repositioning, skin care, nutrition support, and physical therapy when possible. Blood sugar may be closely managed, especially in people with diabetes or severe stress responses. Corticosteroids are sometimes considered in septic shock, but their role can vary depending on the patient and the clinical situation. modern sepsis care is detailed, continuous, and highly individualized. The global burden of sepsis is enormous. In 2017, sepsis affected an estimated 49 million people and was linked to about 11 million deaths, roughly 1 in 5 deaths worldwide. The risk of death can be very high, up to about 30% in sepsis, higher in severe cases, and even higher in septic shock. Most cases occur in low and middle-income countries, where access to vaccines, sanitation, early diagnosis, antibiotics, surgery, intensive care, and trained staff may be limited. But sepsis is not only a problem in poorer regions. It affects hospitals and communities everywhere, and rates have been increasing in many places as populations age and more people live with chronic disease or immune suppression. Awareness matters because early recognition and fast treatment can change the outcome. The key message is that sepsis is time-sensitive. An infection plus sudden confusion, rapid breathing, low blood pressure, extreme weakness, reduced urination, mottled or cold skin, or a feeling that someone is seriously deteriorating should never be ignored. The most vulnerable people may show subtle signs, so a sudden change from normal can be important even without fever. Prevention also matters: vaccination, hand hygiene, safe wound care, managing chronic diseases, treating infections appropriately, and seeking medical help when symptoms worsen can all reduce risk. Sepsis is frightening because it can move fast, but it is not hopeless. The earlier it is recognized, the sooner fluids, antimicrobials, source control, and organ support can begin. In sepsis, minutes and hours can make the difference between recovery and irreversible organ failure. If you found this helpful, please like this video and subscribe for more explainers.